Hello friends, I am Dr. Srikant Jawalkar. I am a senior neurophysician in Care Group of Hospitals. Today, I will briefly talk to you about fits, or what is known as epilepsy in medical terms, or in Telugu it's called Murcha, in Hindi it is called Mirgi ka bimari. Here, there are various types of fits, but mostly the commonest type is what is called as generalized tonic-clonic seizures. In this, the person who gets the fits becomes unconscious. He has shaking of the hands and legs. Sometimes there is frothing from the mouth, and there can also be blood in the froth because the tongue bite is also can happen. And the person has this fits for a few minutes. After that, he is unconscious for a few minutes, up to a maximum up to half an hour, and then he recovers normally. Again, this also is a very common neurological disorders, and this is very easily treated. The problem is, after half an hour or 1 hour, when the person becomes normal, everybody thinks that he's all right, nothing needs to be done. It's not so, because once a person gets the fits, there is a very much chance of his getting the fits again in future. And if the next fit happens when he is on the road or driving or swimming, etc., then serious injuries can happen. Sometimes the fits are also associated with serious brain disease. So, if a person gets a fits immediately, if a person gets fits once, he should consult a doctor to prevent the future fits in future and also find out the cause of the fits, why it has happened. There are other smaller type of fits, like the person can become just unaware of his surroundings for some time, or he may have jerks only in his hands or legs. And these types are also minor types of fits. The very good part of the fits is that they are very easily treatable, and there are lots of medicines to treat the fits also. Various medicines are there, and the only drawback is that the medicine has to be taken for a long time, at least for 3 to 5 years. And after that, if the person doesn't get fits, he is thought to be cured, and then the medicines can be slowly tapered and stopped. But generally what happens, though the treatment is easy, generally what happens is after 6 months or 1 year, you think that the fits are not happening, so let me see what happens by stopping the medicines. So don't stop the medicines. If the medicines are stopped abruptly, there is a very high chance of getting the fits again, and sometimes the person can get repeated fits and has to be hospitalized. So it's very important that you take the medicines regularly till the doctor asks you to stop. Don't try to stop the medicines on your own. And there are certain precautions, like to avoid driving when you are getting frequent fits, avoid situations where you can injure by yourself if you get a fit, like swimming or going into high-rise buildings, etc. Otherwise, this is a very easily treatable disease. The only drawback is the medicine has to be taken for a prolonged period. And there are some misunderstandings, like fits, persons who have got fits, can they marry? Can the woman become pregnant? Will the child be normal? The answer to all these things is yes, they can lead a normal life if they are taking medicines. So don't worry if you have got fits. You should consult a doctor and take proper treatment. Thank you.